we're gonna talk about rotator cuff injury. What is it and what you can do about it? Let's go! Hi, I'm Melanie the physio, also the co-founder of Capital Physiotherapy here in Australia. Rotator cuff injury is our topic today. Now, rotator cuff muscles are muscles that stabilize our shoulder joints. They are the main stabilizer for our shoulder joint, and they consist of 4 different muscle groups: the supraspinatus, infraspinatus, teres minor, and subscapularis. All 4 of them work together to help stabilize your shoulder joint. Rotator cuff injury are generally what we call an insidious onset. That means it's a gradual build up to this injury. It's not a one-off incident that's causing this injury. Now, they are generally caused by overloading of those muscles and also poor biomechanics of their shoulder blade muscles. Impingement happens when your shoulder blade muscle is not controlling properly, and what happens is because it's not controlling properly, it causes your shoulder to pinch on top of your shoulder like this every time you try to move your shoulder above your head or anything above shoulder level. It have a tendency to pinch the structure underneath, and rotator cuff actually locates right at the top of your shoulder, everything attached there. So if you keep pinching on it every time, that's how they injured it. Now, this video is not about shoulder impingement. If you want to find out more details about shoulder impingement, don't forget to check out our link up here after this video. Now, today in this video, I'm going to share with you some tips that you can do to help relieve your rotator cuff injury pain. Now, the first tip: anti-inflammatory drugs. Because the muscle tendon or the muscle itself is irritated by the constant pinching of those tendons, they are inflamed. That means they're swollen in your shoulder joint. So taking anti-inflammatory would really help reduce that swelling and in turn help with your pain. Now, the second tip is to ice it. Same thing as what anti-inflammatory do. Ice actually helps reduce your swelling a lot. So putting ice over your shoulder for a good 5 to 10 minutes, depending on how well you can tolerate the ice. Obviously not to the point that you have ice burn, but just to the point that it starts feeling a bit cold, sometimes even slightly numb, and then take it off. And then do that as often as you can. Sometimes if it's really, really bad, I even tell some of my clients to do that on an hourly basis, just for the first week or so, and you should see a significant change in the level of your pain. Now, the third tip is to avoid anything that is above shoulder height. So anything down here, it's fairly okay generally, but anything that goes past 90 degrees, this sort of way up, it generally will start aggravating the pain, because like I said, generally people who have rotator cuff problem have shoulder impingement with it as well, and that's the reason why you have rotator cuff injury to begin with. So when it's very acute and very painful, you really want to try to avoid doing things that's over your shoulder height. Now, the fourth tip is a pretty obvious one, but a lot of people is still doing it, is to avoid sleeping on your painful shoulder. If it's already sore, stop lying on it, stop aggravating it, because the more weight you put on it, the more aggravated it will be. So do not lie on that sore shoulder at night when you're sleeping. Now, the fifth tip is actually a stretch that we're going to teach you to help relieve your pain. Now, it is called the sleeper stretch. With this exercise, you want to lie on your side with the sore side downwards. So you're lying on the sore shoulder. Now, you want to make sure that your shoulder is stacked directly on top of the other shoulder, that you're not rolling too far forward or too far back. Now, all you want to do is then extend your arms out so that your elbow and your wrist is directly in line with your shoulder. And all you want to do is then bend your elbow upwards, and then you're gonna push your forearm down towards the floor or towards the bed if you're doing it on the bed. And hold that there, and you should feel a stretch all the way down your shoulder. Hold that there for a good 30 seconds and see whether you can push it down even further, and then hold it there for another 30 seconds, and that's it. Now with this stretch though, you really want to compare it with your other side and see what a normal range for you is. So look at your uninjured shoulder and then see how far you can actually push downwards, and try to aim to be at the same level of your good arm, and then try to achieve what is normal for you even on the injured side. Now the sixth tips is gentle massage using a massage ball. So you're going to use a massage ball, and I'll show you the link down under on where to get those massage ball online. Now a lot of the time when the rotator cuff muscles is injured, they spasm up, and a lot of the time the spasming itself, it's what caused a lot of your pain. So if the muscle stops spasming as much, it would actually significantly help with your pain. So you want to put the spiky ball on your shoulder blade, right behind sort of your armpit area where your shoulder blade is. Put them right there against the wall, and you want to roll left and right, up and down to see if you can find any spot that is actually painful. Hold it there for a good 20 or 30 seconds and then move on to find another sore spot. Repeat this process for about 3 to 4 repetitions. Basically try to find about 3 to 4 spots that is sore, and then hover it on the painful spot for a good 30 seconds or so, and then try to do that as often as you can, and that would help in turn relieve your pain significantly. Now, because these injuries are generally caused by poor movement of your shoulder blade, which constantly put your rotator cuff muscle at risk of injury, you might then have a question and ask, so what can I do to actually improve my shoulder blade movement? We do have a useful video up here, so don't forget to check them out after this video. Once your pain settles down, you then need to eventually start to strengthen these muscles so that they can start doing the proper job of stabilizing your shoulder again. If you're interested in strengthening your rotator cuff muscles, then you're in luck. I want you to hit that notification bell button because next week we're talking all things rotator cuff strengthening. In the meantime, while you're waiting for that video to be released, do check out these 2 of our videos, and it explains what shoulder impingement in details for you, and also how you can control your shoulder blade muscles movement. I upload video here every week on health and fitness as well as injury rehab topic. As always guys, I appreciate you and thank you for your support. I cannot wait to make more valuable video for you so that we can enjoy this journey of wellness together. Once again, I'm Melanie and I will see you in the next video. Until then, stay safe, happy and healthy. See ya!